All right, great. So we should have today's session recording, so y'all can go back at any time and ask, take a look at some of the information. So again, hi everyone, I'm Megan Branham with Family Connection of South Carolina. This is part of our how-to series, and it is understanding home and community supports and waivers. So for those of you not familiar with Family Connection, our work is across South Carolina. We are working with families who have a child with a disability. We are really here to provide that support and information to families and caregivers so that they can make the best decision for their child's care. And what we're going to focus on today specifically is home and community-based waivers. So there's a lot to go over, but we are going to give an overview of the different types of waivers, processes for applying, receiving services, and just any other specifics about a particular waiver. So very quickly, just to kind of give a starting point for what waivers really are, it's an opportunity for individuals to receive services that are not covered under the state's current Medicaid plan. So it really is designed to assist individuals of a specific population to receive those services in their home, in their community. And there are currently 8 different waivers that are administered by different organizations within the state. The waiver summary chart was what was sent out prior to today's training. It will also be sent in the follow-up email after today's training. And again, if for some reason you did not get the email with the PDF, please put your email in the chat. You can send it directly to me or just drop it in and I will include it in the follow-up. But that waiver summary chart is really going to be your best resource for a quick overview of each of the types of waivers, their eligibility, how to apply, things like that. So that's really going to be your best go-to resource. And certainly you'll also have a copy of today's PowerPoint you can go back to and refer to as well. So the first thing that's important to know is that the Department of Disabilities and Special Needs operates several of the waivers. So within the Department of Disabilities and Special Needs, they do have the following waivers: head and spinal cord injury, intellectual disabilities and related services waiver, and then the community supports waiver as well. And we will go through a little bit about each of those, but I think it's probably important, just as a starting point again, to kind of make sure that everyone is aware of the terminology, because it's different terminology and may mean different things to different people. So here we have just kind of an overview of case management, just connecting individuals to the services that they need, kind of linking and monitoring a family's needs and helping to kind of manage their care. Early intervention is really that work that's focused on in-home with families that have little ones, so birth to 6. And it may include things like speech, physical therapy, occupational therapy. And I think a lot of individuals in our state often think of BabyNet when they think of of early intervention. And then respite care is temporary care that is provided to caregivers in order to, kind of accommodate for the need for having time to kind of step away from their caregiving roles, whether it be planned respite or emergency. So to participate in a waiver, and this is directly from Department of Disabilities and Special Needs. Again, it must be able to receive services in the home or community, meet the criteria for care in that waiver, be Medicaid eligible, have needs that could be met by the waiver, obviously be given a slot for that particular waiver, and then that they have to regularly, monthly use a service of the waiver every 30 days, or else are at risk for losing their spot on the waiver. And case management does count as a service that can be utilized. I do want to mention, and we do another training on Medicaid, and this is where sometimes things can get confusing and folks have questions about. That's why we're here, if you do. But for individuals to participate in a waiver, most folks are on fee-for-service, or what's called regular Medicaid. So within the state's Medicaid, there are some categories that are not eligible to participate or have a managed care organization plan. So another company, an insurance company that manages their care. So they are just going to stay in fee-for-service. The home and community-based waivers are a category that are in that fee-for-service. And I only mention that because as families are deciding, perhaps they're applying for Medicaid for the first time, and they may have questions, or it looks like have an option to choose an MCO. That maybe just be something to consider if that is going to help best meet the needs of your family. If you're also applying for a waiver, knowing that you have the flexibility to be on fee-for-service is going to be helpful, for your family. So those are some things that we can talk through with you if you have questions about. Again, oftentimes we're making a lot of choices in what feels like a very short period of time, and you're trying to balance both what your child or young adult needs right now, and then also what they need potentially in the future. So we understand that, and that's why we're here, just to kind of help you navigate some of those questions as they come. So a participant, once they're on, they will continue to receive those services unless the following are true. So perhaps they no longer meet the level of care, maybe they no longer want to receive that particular waiver, they don't utilize service, are no longer Medicaid eligible, end up being admitted for some type of inpatient facility. Maybe they move out of state, or they decide to move or accept another waiver on the list. And that happens sometimes with families, just depending on the needs of their child, the age, things like that. So to start with, contacting your case manager, early interventionist, letting them know you are interested and want to apply for a waiver is the first step. If you don't have a case manager, maybe you're not connected to DDSN, we can talk about how to go about doing that. And then that individual will work together the information needed to complete the application, and then you'll get the written follow-up about your application. So if you already have a case manager or service coordinator, if you're already connected with an early interventionist and you haven't asked them, or y'all haven't talked yet about a waiver, now would be a great time just to let them know you've gotten some more information, you're really interested in applying. If for some reason you are not connected with DDSN, and again, this may happen for families who move from out of state, or maybe they have a new diagnosis for their child, and now they're interested in connecting with DDSN. The best way to get in touch with them is their toll-free number. That's 1-800-289-7012, Monday through Friday, 8:30 to 5. And this is just a brief overview of what is needed for that call. Again, just basic information about your child, your family. They're going to ask questions about your child's disability, your residency status in South Carolina, and then go through the intake process with you. And all of that, you'll be notified via letter once you get, for the application process, and then another confirmation about eligibility status. So you can always, DDSN's website has this full listing on there, and I put the link to the DDSN website if you want to look at that a little bit more. But again, that's really just more for anyone who has not been connected yet with DDSN. All right, so let's get into this real quick. Again, let me know if you have questions and we will get to them as we go. But the community supports waiver. So this is one of the waivers that is administered by DDSN. You'll see in each of these categories, you'll see who serves, level of care, and who the contact entity is. And so this community supports waiver is designed for Medicaid eligible children and adults with intellectual disability. They must meet the level of care required, for them to be eligible for these services. And DDSN is the point of contact on that. Another thing that you'll notice as we go through is that some of these services are going to look similar, and there is a lot of similarity in the types of services, but there is also some variation in the services that are provided. So for these slides, on every waiver, you'll see that some of them have, again, very similar type services available, but there may be some in particular that you or your family is looking for. And that may also help decide what waiver options might be right for you. So again, a lot of the kind of typical services that we will see on in these categories are things like personal care, maybe adult care, transportation, maybe some type of specific service around nursing, behavioral health, specific equipment or supplies, in this instance, incontinence supplies. But the PDF that you all get of the overview of each of the waivers is going to bullet list out every single service that is available, so you can kind of go through and look at those individually. The IDRD waiver, which is another very common waiver, the intellectual disability / related disabilities waiver, again, is another category for all ages and with a diagnosis of intellectual or related disability. Again, DDSN is the point of contact on that. And then there are some very similar services in there that are, that are also listed within, provided within this waiver. I would say there are a little bit more in this category as opposed to the community supports waiver. So there are more specific services that are listed. I think one, that we do have on here, which I think is one that maybe a lot of folks may not know is available, are things like pest control treatment for someone to come in and provide that in home, again, just to keep the home environment safe, healthy for the occupants. That is a service that's available under the community, under this particular waiver, the IDRD, and is, again, one that folks may not be aware of, but is one that I think, is something that could be a huge benefit. And again, for families that are trying to determine which services to utilize and meet the requirement of having a service every 30 days, pest control could very easily be a great option for a family. For a family to choose from. So the last one that I'm going to mention here for right now is the HCBS waiver. It's the head and spinal cord injury. Again, this is specific for a diagnosis of a traumatic brain injury or spinal cord injury for all ages, and is again within the DDSN, that particular division. You'll see some of the waiver services are very similar in terms of those type of day-to-day care, but then also career prep, employment services, environmental and vehicle modification as well. And again, depending on the individual's needs or the family's needs, some services may be better for now, and others maybe are something to think about possibly for later on. Okay, so yes, so I'm looking at the questions real quick, so y'all give me a second to read through. I just saw a couple come through. So yes, we will talk about autism in just a minute, and then waiver. So yes, you can be on a wait list for more than one waiver, but you can only be approved. You can only accept one waiver at a time. So we will often talk with families or suggest families go ahead and apply for anyone that they may be eligible for. But then once that option comes up for them to select, they must select, that waiver, and they can only be on one at a time. So there is a wait list. The wait list depends on the waiver. So typically, yes, the community supports waiver, the intellectual disability waiver, those are typically ones that have the longer wait list just because there are so many individuals currently receiving services. So if, and the wait lists vary, frankly, several months, up, just kind of depending with where they are in the process and how many other people are waiting. Obviously, one thing to consider is the earlier you apply, the better, just to allow for the wait time. It can be, again, several months, year plus, just depending on which waiver. And again, another reason that families opt to apply for multiple waivers at a time. So that kind of helps increase their chances of getting one sooner. So whichever one they, comes up first, they can go ahead and select that and go ahead and start receiving those services. So, all right, I'm going to keep going and I'll come back to the questions in just a minute. But thank you all so much for putting those in. Okay, so community long-term care within Department of Health and Human Services, which is Medicaid, operates the following waivers. And these are the other set of waivers that are listed on the overview sheet. Community choices, HIV/AIDS, mechanical ventilator waiver, and then FCC, which is the medically complex children's waiver. So we'll start with this one because that's one that a lot of families end up deciding is best for them. And also that the wait list in some instances is maybe shorter or less children that are served on this particular waiver. So again, it's medically eligible children, and the contact agency is going to be through HHS, so state Medicaid. So there have been some updates to MCC. The age limit has been increased to 21, and they are authorized to receive certain particular environmental modification services, and that they're really kind of trying to expand the provider network for respite within this category. That's just another thing to note for these waivers is that, often yearly there will be updates to waivers. Medicaid is oftentimes the one that will distribute that information. And just know that we try to put it out as well on our Facebook, on our newsletters, things like that, just so that y'all know if there are proposed changes that are coming, you're aware of it, or that when those changes do come into effect, what those particular changes are. So just something to be aware of. And if you have questions about it, that's I will drop our 1-800 number in so that you can contact us with additional questions. Okay, so again, community choices waiver is another one of the waivers that is within HHS and is for those medically eligible individuals over the age of 18. Again, you'll see this starts to kind of look familiar, that those services these are some of the services that are available. Again, some of those day-to-day, services, transportation, things like that. HIV/AIDS waiver is a waiver specifically for individuals with a diagnosis, and Medicaid HHS centralized intake does help to, navigate getting application. And for all of these, this one has, the level of care is at risk of hospitalization. Again, the goal, the intent of these is that these services are able to be provided in home and community, and that with, possibly avoiding some type of inpatient care, whether it be some type of facility or hospitalization. So there is that to just keep in mind. That's very specific to this particular waiver. You can see what services are listed there as well. The mechanical ventilator waiver, again, those individuals who are older, over the age of 21, requiring that service, requiring mechanical ventilation, and those services listed there as well. So again, you'll see some of it is really specific to the type of care that's needed with that attendant personal care, nursing services, again, just depending on the category or the diagnosis. Okay, so real quick, I'm also going to mention this one because this is maybe one that there's been a change in recent years, and some folks may not be aware that this is a waiver because it wasn't always a waiver in the state of South Carolina. And that's within the continuum of care, so which is part of our state's Department of Children's Advocacy. So the Palmetto Coordinated System of Care for Children has a home and community-based waiver. That is, again, for youth who are primarily under the age of 21 and have, oops, sorry about that, have a, let me go back, have a mental health diagnosis that may require a higher level of care. The contact agency for that is the continuum of care within the office of the Department of Children's Advocacy. There is an application online. There's a point of contact for that, and those services vary, but are really focused on the wraparound, what is called wraparound services for that child, or for that youth, I should say. So a lot of times with a focus on behavioral, mental health, whatever is particularly needed for that child and that family. So I mentioned that as well, just because, again, it's a smaller number of participants or families, individuals that are enrolled, but again, maybe something that could be a useful option for a family. So just real quick, and I am going to stop sharing in just a minute so I can get back and actually show you what the waiver summary sheet looks like, and then also answer some of your questions. But again, just keeping in mind, there are different links for different, waitlist and waivers. I think I saw a comment from someone about maybe several years. Unfortunately, that's not uncommon, depending on which waiver they may be waiting for. Every year or so, families are maybe notified of their place. If you haven't heard too of kind of where you're at on a wait list, that's also a great question to ask of whoever, Medicaid or in many cases DDSN. What is my spot on the list? Where am I? Have we made, are we still on that list? Even confirming that yes, we're still on wait list for this, but also seeing like what progress, what movement has been made within the last year. So that's also a question that you can ask and just confirm that you still have a spot and kind of where you are in that list. Again, people can be on a wait list for can be on several wait lists for several waivers at once, but you must select which one you want to be on. So if your name happens or your child's name comes off the wait list, you have to select the one that you're being offered, or again, you can also make the option to not choose that and wait for the other ones. But again, not knowing how long that could potentially be, it's just kind of it's kind of a best guess at that point. So where there's an opportunity to go ahead and select, that is certainly a good option for going ahead and receiving their services. And again, the waiver services are both similar and different in that it just really depends on the needs of your family and what's going to fit the needs of your child, your young adult. So I'm also going to put this in the chat, our number, but this is our support and information line. So our work is really helping families to decide and determine what might be the best choice for them. Not just waivers, it might be also with Medicaid or TEFRA or, education, whatever it may be, just making the best decision for their child and their care. You can always contact us on our support and information line. It's 1-800-578-8750. And you can contact us that way and talk to one of members of our team about your questions. And you can also contact us online on our website as well. I'll put that up here too. FamilyConnectionSC.org is another resource as well. So I am going to stop sharing for just a second and try to, okay, now I can see everybody. All right, now I can see everyone where you're at. So what I'm going to do is go ahead and drop the information here for Family Connection, for our link, and our 1-800 number, just if you have follow-up questions from today's presentation. So bear with me as I pull that up for you. And then let me go back to some of the questions and just make sure I didn't miss anything as we go through. Can anyone still hear and see me okay? I see some of y'all. Okay, all right, good. Okay, thanks. Hold on just a second. Let me go through and read and just make sure I didn't miss anything. Okay, yeah. So again, it looks like some of the questions. Oh, and also let me see if I can share with you all real quick to just what this waiver summary sheet looks like before I forget that. Yeah, I was seeing a couple questions about the wait list too. So again, not uncommon, unfortunately. But again, now is certainly the time to go ahead and get on if you're thinking about it. This is the summary sheet that I mentioned. So this is what you're going to be looking for when you your follow-up email that you'll receive. This just has the chart of all the different services, and again, kind of where the point of entry is, what the eligibility is. The one thing too that it has on here, and I think I did see a question about waitlist. This is the enrollment number. So periodically, the Department of Disabilities and Special Needs will publish the current wait list. Typically, that does happen when as we're starting a legislative session in January, and they have to present every state agency has to present a budget. So oftentimes numbers on the wait list of how many families or individuals are waiting for services get published as part of that presentation, or just periodically from other updates from the agency. I don't know that I have a current list. I have seen one recently, but I couldn't really speak to the current number of what those wait lists are. Okay. So haven't heard of any specific circumstances that would particularly would elevate someone to a different list on a different position on the list. That may be something to also though just talk to a case manager or an early interventionist or someone that you're already working with if there are other supports that are needed during for life changes while you're waiting. I should have also mentioned that too. There are options, and part of our work does we are also looking to support families and helping them find and identify services while they're waiting. So in the Respite Coalition is a great example. There is some support for respite care in certain situations through the Respite Coalition for individuals who are not on a waiver, but that may be an option for a family, just as an example. So there are other community resources out there that a family may want to explore, look at getting while they're waiting. So, there are needs that are really should be met through the waiver services, but if you're waiting for a slot and you still need those services, what might be other options? And that's something we will work with as part of our team across the state to know that, hey, if we're looking at vehicle modification, maybe that's one, or mobility equipment, maybe there are community organizations that we can reach out to and see about a family getting assistance from, knowing that they need the service, but they don't yet have a waiver slot. So something else just to keep in mind as well.
Megan, can I comment on that one question you have here about
you see that
being bumped to the top of the list?
Yeah, so a child could be approved for Medicaid if their family does not qualify for Medicaid based on income. Oftentimes, a child may be eligible for TEFRA because it doesn't take into consideration the family's income, but it does look at the child. And there are specific categories of diagnosis or disability that TEFRA looks at as well. So for some families, applying for TEFRA is a great first start just to get services, Medicaid services. And again, based on the child's needs, not on the family's resources. We do help families apply for TEFRA and can work with you on that as well. I thought somebody had a question, or maybe it was WC. I thought maybe you came off mute if you had a question.
Just a comment about the one reference you have in here about do you get bumped in a list. They may be referring about residential housing. So if you're in IDRD waiver and one parent has passed away and the other one's fragile, there is a critical list, and that's what you might be referring to, where you can get bumped up in a list, but otherwise they're pretty consistent. So, and what you said is very, very important about every time that you meet with that service coordinator for your annual review, you ask where you are on all of your waiting lists and you track those numbers, because that's how you're moving up. And because there are emergency situations and they are not supposed to bump in the list, but we have seen it happen. So
that's great. Thank you. Yeah, that may be what the question was.
Yeah, I think it's referring to that.
Yeah. Okay, great. Thanks. Yeah. Again, it is part of just kind of seeing, again, reinforcing where you're at in the on the list, because I think the other thing too, just to keep in mind, and for anybody receiving Medicaid services, that as part of the unwinding that's happening with the end of what was the public health emergency for COVID, people were on Medicaid and they weren't losing their coverage. During that time, that's changed, and now states are looking at who is still on their Medicaid rolls, who's still getting services that maybe has aged out of a particular category. Maybe they've moved states, maybe they no longer are eligible. So some of that does impact the number of people receiving services on waivers. So that's another thing too that can change or decrease the number of people waiting, because let's say someone was on a waiting list for a waiver and then moved out of state, right? They're no longer eligible for that slot, goes away, the next person moves up. So there is some of that happening right now as part of the Medicaid unwinding, which really started happening back in the spring and will go at least through this coming spring. So we have another like 6 months or so of that. So that's also just something to keep in mind. Okay, so I know we're coming to time real quick, but I also wanted to see, there were some questions about personal care assistance, community supports around employment, and some of those may some of those may be ones that we end up talking about a little bit offline. And I'm gonna, again, put my contact information in here too. Some of it, part of our work does in talking with you all one-on-one is helping to know like where you are in the state, what other services you've looked at, and would be something that we could maybe talk through a little bit longer, or connect you with one of our family support specialists in other parts of the state that could help to kind of walk through some of those options. So again, just to give you all the information that you need may require a little bit more time. And if you're open to that, of course, contacting us or emailing me directly and just, saying that we have, we have some follow-up questions and we want to get connected. There was something about funding. Yeah, exactly. So someone's already putting in folk rehab is another one. And again, depending on location of where you are in the state, we just did a great training about SSI a couple of weeks ago and vocational rehab and where the centers are located. So that may be something to just to look at as well. Okay, let me just go through real quick. So CC waiver. Okay, so it looks like there's some maybe that have maybe diagnosis specific questions, or there was one about transitioning off of MCC waiver and having, so there may be instances where the case manager or maybe its early interventionist does not know or is not familiar with all the resources that are available. That's really where we have parents that will reach out directly to DDSN and ask about services, or we will help them kind of navigate putting in referrals or navigating that as well. So, again, I think maybe getting some clarification from you, and maybe we can talk to a little bit more about how to go ahead and get that process started. And that some things that you can do already, I think, and myself as a parent, I'm like, can I do that? Can I put in that referral? Do I have to wait on somebody? And sometimes it's like, you can go ahead and do that and you don't have to wait on anyone else. Yes, there may be some additional documentation and resources that are needed, but you can initiate that. You can determine maybe there's another provider that is going to be better suited to helping you identify what other resources are. I will say MCC waiver, the care team there is usually pretty knowledgeable about what else is, what other services are out there. And so kind of helping connect with them just to make sure that you're getting the latest information. So I would say I'm going to put my, real quick before I forget here, I'm going to drop my, you should have my contact information, but this is my direct family connection email. So if I can't help answer it, I will get you to the person on our team who can, just depending on what your questions are, where you are in the state, age of your child, things like that. I'm going to go ahead and put that in. I'm also going to drop in the 1-800 number as well while we're wrapping up, just for some of those questions. And again, I know 45 minutes is a very short period of time. So this is really just intended to kind of give you an introductory of waivers, maybe prompts more questions and answers at this point. We will have subsequent trainings where we'll maybe go a little bit more deeper in some of this. But again, for some of those that are really specific, questions that maybe need a little bit more time to go over, us to look into some resources that might be available to your family. That's really why we're there for that 1-800 number and direct one-on-one support. So I am going to, what will happen next is I am going to send out an email. Thank you so much. Last call for anyone who did not put their email in the chat that did not get the email yesterday with the Zoom link recording. Go ahead and drop your email in, or if you want me to send it to a different email, I'm more than happy to do that. You'll get a copy of the PowerPoint of the waiver overview as well. And then just how to contact us directly with any other questions. I am gonna, for those of you that I didn't get to your question today, I'm gonna pull in the chat, I'm gonna pull it out and reach out to you individually, but you can always contact me directly as well. I also put in the chat the survey link. You should get that survey that pops up when this Zoom link closes. So just click on that. Always appreciate your feedback because it helps us, tailor trainings to what's most relevant for y'all, what you need. And if you have any other questions, you know how to reach us. The recording should be up probably early next week on our YouTube channel, and I will also put that in the follow-up email so you can go back and watch it or share it with anyone who happened to miss today's training. So with that, I'm going to go ahead and wrap us up since we're right at time, and please look to hear from me later today with some follow-up information. And thank you all so much for being on. Hope it was helpful. Bye, everyone.